This is an ABC News special report.
Breaking news, there's been a huge epidemic of radiation due to poor bite weeks from UCLA students. As you can see in this room right over here, there's a patient that's been exposed to radiation. Hello, miss. Actually, she's clinically dead. As you folks back home can see, UCLA students clearly don't know what they're doing. So we're going to head straight to the radiograph room at USC, where Dea Sarmiento, a world-renowned radiographer, will show you the proper way to take bite wings. In order to take proper bite wings, we must first make sure that the x-ray room is properly set up and that we have all of our armamentarium ready to go. Make sure the sensor is covered and that you have your proper bite block ring kit, gloves, and patient bib ready. Also make sure to cover all surfaces in the room for proper infection control. When setting up the sensor, remove the plastic from the bite block and place the bite block in the center of the sensor. Then place the indicating arm on the bite block, typically on the side away from the sensor. Then place the aiming ring on the indicating arm. To make sure the ring is in the proper place, the sensor and bite block should be directly in the middle of the ring as Dea is indicating. Once all of your equipment is set, you may seat the patient and place on the lead apron, securing the thyroid collar around their neck. Then you may place the patient bib over the lead apron. For patient comfort, place edgy strips along the outside of the sensor. For premolar bite wings, make sure you have the sensor cord wrapped towards you. Ask your patient to open their mouth wide and place the sensor so that the edge of the sensor is at the middle of the maxillary canine. This will ensure that you get the distal of the canine as well as all the premolars in your x-ray image. Then have your patient bite down, but make sure that they do not bite down on the cord. Before exposing, make sure the aiming ring is close to the patient's face. Then you will move the tube head towards the aiming ring. When taking bite wings, we prefer to use the paralleling technique. So we need to make sure that the tube head has a vertical angulation around positive 10 degrees. When exposing the x-ray, make sure to check and adjust for the proper exposure settings. Once they are correct, then you may take the x-ray. For molar bite wings, have the patient open, readjust the sensor, and move it more posterior so that the edge of the sensor is now at the middle of the second premolar. This will ensure that you get the distal of the second premolar and all of the molars in the x-ray image. When switching from the patient's right to left, simply remove the sensor and readjust the equipment for the left side. Because it's a bite wing, all you really need to do is reposition the indicator arm and in some cases possibly the aiming ring as well. When exposing the left side, it will be exactly the same as the right side. Keep in mind to start with the premolars first to ensure patient comfort and avoid gagging. Also remember to use the parallel technique with a vertical angulation of 10 degrees. Now we will take a look at some common errors. Now we will take a look at some correct bite wing images.
Oh, are you videoing?
Obviously.
Oh, hold on. No,
Okay.
This is good. Gonna want to put it in the middle.
Oh, you gotta take the sticky off.
Oh.
Cause you had an x-ray, you had to bite down, sing a sad song, but you haven't looked round. You say you don't fly.